going live tomorrow morning with the March of Dimes to talk about preeclampsia and aspirin. So is anyone taking aspirin? Tell me down in the comments. I would love to know. What do you guys, thank you so much for the likes, Jayla. I really appreciate that. That's my email telling me that I'm live. What a shock. Thank you so much, email. How's everybody's day? How's everybody feeling? Let's see. I wrote a post today on what to do if you're overdue. So anybody overdue, tell me in the comments. I would love to hear. I went overdue on all of my kids. So first baby, 2 days overdue. Second baby, maybe 3 days overdue. Third baby, 12 days overdue. I will say that I was pretty sure that their dates were off. And so, I'd kind of planned on going overdue, but I don't know that anything really prepares you for 12 days overdue and I should have just told everybody that I was just going to have my baby before the end of April, because I was due April 15th or something like that, 17th. And then I had her on April 29th. So yeah. Anyway, so in that post, is anybody overdue? Tell me in the comments. Are you getting to that point? A lot of people ask, what should I be doing? And the thing is, the studies just show that there really isn't anything to do. And so I wish, hello, Paige. My daughter's name's Paige. What I wish I had done was put my feet up and not not worried so much about it. I think we all think we sort of control it, we can manifest the heck out of labor, and that's just not true. And so, yeah, I wish I had just realized I didn't have control. And I feel like I had, and you guys tell me in the comments if this rings true for anybody. I think I sort of had some guilt for the fact that I hadn't gone into labor yet. I had some control over it. And I wonder if that's normal behavior. It's probably crazy. It really sounds crazy later now that I'm not pregnant anymore. But and I had a son, my oldest son, who was 9 at the time. Every night before bed, he was kind of like, "Are you going to be home when I wake up in the morning?" And that gave him a lot of anxiety, and I felt guilt over that. So it's kind of crazy and silly. Do you know anything about implantation? I do answer pregnancy questions. I can't answer anything too personal or specific, but I can answer generalized questions, or I can tell you I have an article on my website. So yeah, I know that whatever the name the blastocyst or whatever implants on the uterine wall. That's about all I know about implantation. My specialties really start once you pass that first trimester. Vulvar varicosities. I have heard of those, Brittany. And if you have them, I am so sorry. I've worked with a few nurses. If anyone else has them, tell us in the comments. So, you guys know about varicose veins, right? You've probably heard of them with other people having them. But this is one that happens in your lady bits, and they can be extremely uncomfortable. So, some people have tried, it's like a compression garment down there. My friend at work tried it, and it was so uncomfortable. So at work, it was even worse because, we're standing up all the time. I was working as a labor nurse, and it was just miserable, but also the compression garment, because imagine compression right there, just made it worse. So I just don't know anything that really makes it better. I am really sorry. I have heard of some people who get a cream or something that might be able to help. If anybody has any tips or comments, tell us down in the chat. Let's see. Can my baby be healthy without having symptoms in my first pregnancy? I'm not sure what symptoms you're talking about. Sorry. I'm 5 months pregnant and have lots of cramping, no blood. Is that normal? It's definitely something that I would have mentioned to your provider. Cramping can be normal. It's hard to know what you mean when you say cramping. Cramping can be normal as the uterus grows, but it is something that you'd want to talk with your provider about. So Brandy says, I haven't started my period, brown discharge and pulling sensation cramps, and I'm confused. Sorry, Brandy. I don't know too much about like early pregnancy symptoms, and that it can vary so much. So if you have a question, I always recommend taking a pregnancy test. I always did the dollar store ones because I'm cheap and they're really just as good as that. Rosa says, my contractions are hurting right now. Guys, remember contractions can be normal. So don't freak out if you're having contractions early on. They can be practicing. It's kind of like, what does the pattern look like, right? And it depends on how far along you are in your pregnancy for sure. Is cervical insufficiency common? Not so much. So cervical insufficiency is kind of when your cervix just isn't holding the baby up. So as the baby applies more pressure, it kind of just opens up. And often they'll do something called a cerclage where they like sew it shut, which sounds horrible, but people say that it's not that bad and it works, which is amazing. I mean, it kind of makes sense. Like if this thing is just going to open up, of course it makes sense to sew it shut. So if you guys have questions, you can ask me in the comments. Welcome Facebook, YouTube, Instagram, and TikTok. Is it normal for a 6-week ultrasound seeing just the gestational sac and yolk sac, but no fetal pole? I mean, it's hard to tell, Juliana, because I don't know. I don't know too much about ultrasounds. I will say that on my first child, we thought I was further along than I was. And so my amazing doctor just said, because they didn't find a heartbeat on it, he just told us, well, 50-50 chance your baby's dead. Literally what he said. When in reality, it would have been better to say, we don't know if the ultrasound's too early or if the baby just doesn't have a heart rate. So we're just or heartbeat. So we're just going to check again in a couple weeks, right? That's what they're looking for. So it just, our dates can be off and that can really affect that type of an ultrasound. So yeah. Only swelling in left leg, Brittany. I do. A lot of people have one swelling more in one leg than the other leg, but I would definitely bring that to your provider's attention. Does pelvic floor dysfunction lead to cervical insufficiency? Not usually. BMH. I had definitely had symphysis pubis dysfunction. No issues with my cervix though. They're not really related usually so much because one's the separation of the pelvis and one is an opening of the cervix, and they're not like tied together. Stinging or burning sensation throughout my body is normal 33 weeks pregnant. Man, hormones can be crazy, but that is something that I would bring to your provider's attention, I think. I don't know what that would be. And just see if it has anything to do with like what you're eating, what you're doing, anything like you're around. That'll help them kind of solve the situation. Why do I get UTIs so much from being pregnant? So when you're pregnant, you have extra blood flow down there. You might be making extra discharge. Sorry if this is TMI, but the pregnant ladies here probably don't care. And that can lead to increased UTIs. You're just more susceptible to them and things like that. I do not know much about HCG, so I won't be answering any comments about basically anything before the first trimester tonight. Shalita on Facebook says, hey, I'll be 38 weeks tomorrow. I've been having diarrhea days apart from each other, increased discharge, lightning crotch. Braxton Hicks is my 6th baby. Would it be okay to get a sweep done at 38 weeks? Shalita, I'm not sure if your provider will do it or not. I've heard of some providers who only do it at 39 weeks. Some say they'll do it at 37 weeks. So I don't know. It's never wrong to ask your provider if you want to get that baby out and you're past 37 weeks. I don't think they're going to do it before 37 weeks because studies really show that babies do best when they are in that long. So that's my guess. Soph said, I just found out I'm pregnant with my first. What should I prepare for? Soph, congratulations. I'm so excited for you. I do have a couple early pregnancy posts over on my other site, Pulling Curls. The main things you want to prepare for is make sure you're getting that prenatal vitamin in, get your prenatal appointment. A lot of people get super frustrated that those first appointments really are not for a few weeks. And I'm actually doing a campaign with the March of Dimes where they talk about getting aspirin in those first 12 weeks. So if you're not being seen by your doctor until after 12 weeks, you can always ask them on the phone, should I be taking aspirin? Because a lot of people are just now saying, like, along with that prenatal vitamin, you're going to want to take an aspirin because it has been shown to help prevent preeclampsia, but only if it's right for you. Not everyone should be taking it. So come join me in my live tomorrow morning. It's at 11 a.m. Pacific time. I'm super excited to be on with them. And then I would recommend checking out prenatal classes. I have an online prenatal class for couples. I call it the easy way to get prepared for birth. You can do it in just 3 hours, and I just dropped the price for a little bit on a summer sale. So it's really only $67 right now for the shorter class. And then if you want to come join me for breastfeeding, baby sleep, baby care, partner tips, that one is $147 right now. So I would love to have you guys come join me in there. I never think it's too early to start thinking about ways to prepare for birth, but I'm super excited for you. So sounds like you have got it going on. Is extreme tiredness and contractions a sign of labor? Cooper, I actually have a post on the pregnancy nurse, so you can always find it under my LinkedIn profile, but about if it's extreme tiredness. I've looked at the studies, and they do show that some people have like a extreme fatigue just like come on right before labor. I think the idea is that baby just like your body's just wants that nap to prepare for labor. But it's hard to say because extreme fatigue is also a lot of like 38 weeks pregnancy on. So I think it's hard to tell if that's really a sign. Yeah. Let's see. Lucy. Hi, Lucy. Asked on Facebook, does baby pooping inside increase infection in moms during postpartum? Your videos have been amazing. Thank you so much, Lucy. It can. That's something that we watch out for. So it's called chorioamnitis, which is an infection of the water, and can turn into an infection of the uterus. So it can increase your chances of infection. Talk with your provider. Although, I mean, I think it's officially considered sterile, but I think those babies do have an increased risk of infection. Somebody on Facebook, Shalita, asked, is it true you will always be 1 centimeter dilated due to having previous children? Not always. Some people close all the way up. Some people I don't think do, but because I don't check people like early on in pregnancy, I don't really know. Yeah. And I actually only lost my mucus plug on my third baby. I probably didn't notice it on the other two. I probably just looked in the toilet at the right time. And honestly, I gagged, which sounds dumb because I deliver babies, but it was a lot to take in. So Casey said she found out that she has a possible accreta and may have to get a hysterectomy. I'm so scared of dying. So Casey, that can be, so an accreta is when the placenta like sort of grows into the uterine wall, which can be problematic. I have seen accretas before. I have seen ones where they can take it out. And so I think it's really smart to be getting what could happen like under your belt. But at the same point, I think it's really important not to like let your imagination run away with like worst case scenarios. So I'm glad that they have an idea. They're going to have more things on hand. They're probably going to order some extra blood for you, things like that. You might want to see like if you can have people donate blood for you. I don't know if that's a possibility where you are. But yeah, just I'm sorry, but don't let your imagination run away. And I'm really glad that you know this in advance because then they can be more prepared for things. But I have seen accretas come out just fine. Like it's a little bit of a fight sometimes, and you might end up going back to the main OR after you have your baby just to check it all out. So thoughts on elective C-section. Carla, it's really hard to say. It depends on why you want the elective C-section. In general, you're not going to find the medical community like super excited about them. Doctors are real, depends on your doctor, but a lot of them are real. They really want their C-section rates to be low because a lot of patients ask about it. And so I don't know. It depends on why you're getting it done. And then you just have to decide if the risks and the benefits. Some doctors won't even do them, I don't think, which can be considered like okay because they would decide that the risk to you would be like doing harm by doing a C-section without trying for vaginal delivery. So talk with your provider. I'm not a huge fan of them, but I will say I know a lot of OBs and anesthesiologists who've just gone that route because I don't know why. There you go. Is it normal to feel like baby's going to break your water at 28 weeks? I actually have a post, Top Notch Mompreneur, over on Pulling Curls. So that's my other site. That's my first site. I have a second. Pulling Curls is my first blog and podcast, and then I have the Pregnancy Nurse. But it's a whole post on, can baby break my water? They're moving so much. And whenever I post that on places, people are always like, yes, I'm always worried that it's going to break the sac. So studies don't show that excessive fetal moment is like noted with breaking the bag of water in general. It's usually contractions that breaks the bag of water. Fun fact for everybody that's on here, usually the bag of water only breaks about 15, I think it's like 8% of the time at home, 10%, and then even 15% just breaks on their own in total. Usually, so that leaves 85% the doctor ends up breaking it in the hospital. So, but it definitely feels like there is a jazzercise class going on in your belly and that baby is going to break your water, right? I'm 38 weeks. I don't know if I'm dilated or just feels her head on stomach. How can I tell? On ultrasound, she was super low. There really isn't a way to tell. I hear of people who check their cervix while pregnant. First off, I'm afraid you're going to hurt yourself because like trying to maneuver around your baby to check your cervix sounds difficult. I will say that I check to make sure my IUD's in every month, and you check to make sure the IUD's in your cervix. But I've checked so many cervixes, it's really easy for me to know what I'm looking for. And there is way more to a cervical exam than just, is it open a little bit, right? And so I wouldn't recommend checking your own cervix. And ultimately, it doesn't really matter what your cervix is doing. It more depends on what signs of labor you're having, how often contractions are, things like that. So the main way to tell is to have a professional check you and see what they think. Yeah. Katie, I think it says, I'm scared to get pregnant because I had a bad curvature of the spine. Is this a concern? It can sometimes be an issue with getting an epidural. You could ask your OB, like just at a regular well women checkup. And then sometimes they can talk with anesthesia and then get back to you if it's like kind of like more than they know. They know a lot of different things about the curvature of the spines, but OBs don't know everything because they don't give you the epidural. I actually had some pregnancy induced scoliosis with mine, that I like had a pain here and they decided that that's what it was, but that my curvature got worse when I was pregnant and then it would resolve. So I don't know. It could end up being a problem. I think that's something you'd want to talk with whoever your back provider is, an ortho or whatever, and see what they think, that if it's going to make it worse or something like that. Lily said, I'm worried with all the horror stories. Is the medical staff usually kind to the mom? Yes. Honestly, if you look at like labor and delivery videos, most people absolutely adore their labor and delivery staff. They're good people, trying to do the best thing. Of course, you're going to have a bad apple now and then, but most people love their labor and delivery nurse staff and have a really good experience. And I recommend coming in feeling positive about your birth staff and that they're going to be there to help you. I think that's going to put you miles ahead. It looks like if you guys have questions, you can ask them in the comments. Hannah said, I'm 37 weeks and my baby is transverse. Any tips, suggestions, or advice? So I do have a post, Hannah, on the Pregnancy Nurse called like Ways to Get Baby to Flip, that has a lot more information, but I do recommend a version at 37 weeks of the doctor can usually, especially if baby's just transverse, flip baby down. I recommend chiropractor. The earlier you start, the better. And also spinning babies. It has some moves that you can give a question. You can give a try. Carla asked if she can ask pregnancy questions. You sure can. I can't answer all of them, but yeah. Somebody asked about low AMH. I do not know that much about AMH, so sorry. Lily said, thank you. Of course, you're welcome. Mila said, an induction when baby is measuring 2 weeks ahead. I'm 39 weeks, no dilation, 80% of face. So if you're 39 weeks, you can have an elective induction. You can have an induction for any reason, depending on your hospital. So talk with your provider. If you want to be induced and you're 39 weeks, ACOG, which is the governing body of obstetricians, gynecologists, says that 39-week inductions are okay. Don't know that much about ovulation. I have tenderness left side of the abdomen with palpitation. Should I be worried? 23 weeks. I mean, it just depends. It could be ligament pain, which I have a whole post over on the pregnancy nurse. So if you go to my link in my profile after I'm done here, type in ligament pain, and that might tell you a little bit about it, because ligament pain can hurt more when you're like pushing on it. But always ask your provider. If you have a new pain that's concerning you, I think it's smart to ask your provider. I don't know that much about HCG or supplementation. What do you know anything about classical incision? What to prepare? Like you're getting a classical incision or you already had one? That's my question there. Yes, somebody just asked about thoughts on taking baby aspirin to prevent preeclampsia, age 35, no history in other births. Tunisia, I am actually doing a campaign with the March of Dimes tomorrow here on TikTok at 11 a.m. So come join us, but they actually have a video out right now. If you go to the March of Dimes, TikTok account, you can see part of the video. And we're going to talk about the importance of taking aspirin. You are advanced maternal age, and so I really think that they would recommend it for you, but talk with your provider. It is not for everybody. There are people that should not be taking aspirin. So talk with your provider, see what they say. But I'm a huge fan of it. I will say, when I read the studies, I was hoping to see like giant drops. It's small drops, but it also showed that there was less like severity of preeclampsia, which is really important, because when it's super severe, that can get really scary for all of us. So talk with your provider about it. What they're recommending is starting at 12 weeks and continuing through delivery. But if you're past 12 weeks, you can always start whenever. That was another thing that I learned in the video that they posted today. Natasha over on Facebook said, should I be concerned about having two subchorionic hematomas? I mean, it is concerning. So those show up on ultrasound. It shows that there's an area that's maybe not attached as well or could have some bleeding. So I would just keep an eye on it. There really isn't anything you can do. I mean, there's so many things to be concerned about. All you can really do is try and chill out and remember that you don't have control over any of that. And often they resolve. And that will be awesome. Tunisia, I'm sure I'm slaughtering your name, so sorry. Yes, please come join me. So it's a TikTok live tomorrow at 11 a.m. Pacific Standard Time. I will be on with another nurse from the March of Dimes. We're going to talk about it. We're going to talk a little bit about preeclampsia, but also the exciting things that this aspirin shows. So tell us in the comments, are you taking aspirin? I would love to know. Okay, Tunisia, they recommended it, but you also suffer from hyperemesis, so it's hard to take pills, and you're in your third trimester. So that would be a great question to ask the March of Dimes gal tomorrow. Like, she's really invested in this, like more than me. And so she might know, like, can you chew it? Because baby aspirin can be chewed, and is that as helpful or not? Yeah. Should I be worried about a bright spot on baby's heart? Are they going to do a follow-up? Hopefully they are. Sometimes those just like show up. Sometimes they're a problem. Again, there isn't really anything you can do to control it. So the worst thing you can do is stress out about it, because studies do show that like long-term stress can be problematic during pregnancy. Yeah. What week is viability week during pregnancy? I'm not even sure anymore. I want to say 24 weeks. But you know, a 24 weeker, if they've been compromised in the womb, is very different than a 24 weeker who just like came out. So yeah. Cece said, I just found out I'm pregnant on Monday. Congratulations, Cece. Everybody give your congrats to Cece in the comments. Yeah. And PMH said she's week 24, I think. Natasha said on Facebook that she is on aspirin due to previous losses. Yeah. So it's interesting, like why I'm seeing people are on aspirin or how long they're told to take it. I've seen some people say, this is not the standard of care, to take it postpartum too. So I don't know, just interesting, depending on where you are based, I think. Yeah. Interesting. Everybody giving their congratulations to Cece. So exciting. After losing a baby, what's the longest it could take for a period to return? Jayla, I am so sorry about your loss. That's really hard. I do not know. Everybody's different. But if it's like not coming around for a while, I would call your provider and see, you might want to take something to like jumpstart it, or it's hard to say. Does hypertension and being on aspirin raise the chances of placental abruption? So that was a big question of mine. What does aspirin show for bleeding, right? Because for all of my being a labor and delivery nurse, aspirin was a huge no-no. So I was interested in the studies because everyone said it would increase your chances of bleeding. Not true. There were no increased incidences of bleeding or problems with moms or babies who took aspirin. So I read a few of the studies, no problems in any of them. So that's the great news. You're just taking a baby aspirin, so it's a very low, I call it baby aspirin, but they call it low dose aspirin. So yeah, I know a lot of people are worried about it. Your mom maybe like, no, you're not supposed to take aspirin during pregnancy because that's what we've always been told. And it actually says on the bottles of aspirin, do not take during pregnancy or consult your provider. And that's why it's important to talk with your provider, because it's not for everybody to take aspirin while they're pregnant, but yeah, it has been shown to be really helpful and especially decrease the severity of preeclampsia. I'm taking 2 aspirin one times a day, 24 weeks, 2 previous miscarriages, and I also have high blood pressure. Yeah. So there are other reasons that people take baby aspirin. This is just kind of like a generalized rule across the board. But I am seeing some people who are taking more, some people who are taking it longer or different or starting earlier, all these different things. Is it normal to be 25 weeks and not really showing on your first? It can be. It's annoying though, right? Because you kind of want to show, but I'll tell you, give you 5 more weeks and you'll be like, nope, I wish this baby was stuck in. So yeah. Should I have children if I have lupus? Definitely talk with your provider, because sometimes we have patients that have lupus that go on to have fine pregnancies, but it probably depends on you and your situation. Lucy asked, is back and pelvic pain normal to have for days after birth? I had to take aspirin as I was bleeding at the beginning. They never said why, but I'm happy baby is healthy and healthy. Yes, back pain and pelvic pain can be normal. Your body's just kind of readjusting, kind of like how you were, early in pregnancy, you were adjusting to your uterus growing bigger. Now your body's like adjusted to it's being bigger and now it's going back. So a lot of times light heat, ibuprofen, but if it's really like hurting your like day to day living, Lucy, I would talk with your provider and see if they have anything they can recommend for you. I can't give any recommendations on medication. Sorry, guys. Except I've just been talking about aspirin for an hour, but Do you recommend surgeries with anesthesia if needed? Doctors giving me different answers. I've definitely been in surgeries on pregnant women. It just depends if the risk of the surgery and having general anesthesia or wherever the surgery is worth it, right? So somebody whose appendix is getting infected, yes, of course we want to get that out of you, and so they will do surgery on them. Just depends. Risk versus benefits is like everything in the hospital, and especially in labor and delivery. So we're just trying to decide if the risk of whatever we're doing is worth the benefit of it, and the risk to mom and baby. We have 2 things to think of versus like if I just went in for surgery now, they're just thinking about the risk to me, right? So it just makes it a little bit extra complicated. Do you have women at 40 pregnant? I sure do, but I sure do see a lot of people online saying how easy it is to get pregnant at 40, and I haven't found that to be the case. So yeah, I always worry that people are going to be like, oh, I'll just get pregnant at 40. And I'm like, oh, it's tricky. Yeah. It's a muscle biopsy. So, I guess the question is, can they just do it under local, quick general anesthesia? It depends on how far along you are in your pregnancy. They may actually encourage you to do it like a little bit later in pregnancy, because, stuff getting to baby later in pregnancy usually isn't as big of a deal if they do it earlier in pregnancy. Can baby aspirin cause spotting? Not as far as the studies have shown. There was no increased incidence of spotting, like problematic spotting, versus anybody who wasn't on the aspirin. Yeah, but come to my TikTok live tomorrow, 11 a.m. Pacific time, where we're going to be talking about it. I would love to see all of you guys there. It would be really fun. I don't know. It'll be fun. We're talking about aspirin and pregnancy, but it will be really interesting. And we're going to have an expert on who knows more about this than me, although I've tried to read up on it and get as educated as I can. Is it normal to feel like something is stuck in the canal? I don't know if it's swelling or not. Man, that depends. Are you pregnant or not pregnant? Yeah, hard to say. But if I had any questions, I would ask my provider for sure. 36 weeks. Any tips for around this time? Melissa, have you taken a prenatal class? I always recommend getting in a prenatal class. Make sure that you're doing any testing or whatever, and then just be kind to yourself, because it's really easy to think that you can still do all the things. But at 36 weeks, you are really doing so much work for the baby. Did anybody see, I saw a news article this week saying that the nutritional needs of pregnant women, like there's a little bit of need for the baby, but there is actually a lot of need for our bodies to like take it in, to keep everything going, because you're now taking out the waste for 2 people. You're pumping blood for 2 people. There's a lot of need for you. And I was like, well, duh. We need a lot when we're pregnant, which means we need to rest a lot, especially in that last month. So be kind to yourself. I don't know what Brittany said, but we got an aw, yay. I love that. Doctors wants to induce me at 37 weeks. I have high blood pressure, but all my tests come back fine. So during pregnancy, there's pregnancy-induced hypertension, or there's like regular hypertension where you just have high blood pressure, which can be a reason to be induced because we don't want to keep high blood pressure around. Normally, those people are also on high blood pressure medication. So if you're not on high blood pressure medication, I would ask them why not. And then there's preeclampsia. And those are 2 separate things. High blood pressure is not the same as preeclampsia. Preeclampsia often shows with high blood pressure. So it's important to understand both of those things. But keep talking with your provider. It is ultimately up to you. If you feel like the blood pressure is controlled, you're on medication, you'd like baby to stay in a little bit longer, talk with them about why they think that wouldn't be okay. Because a lot of times providers will just say, well, you can get induced at 37 weeks if you want to, and then you can make the choice. Yes, I would like to get induced, or nah, that's not for me. Can we wait a little bit? You can always ask, what would happen if we waited another week, right? Somebody asked, should I be worried if they couldn't see anything at 5 weeks and 5 days? It can be really disconcerting. I'm sorry, but your dates may be off. That happens a lot. And so I would just, hopefully they've like scheduled another ultrasound for like a week or 2 later to see if just your dates were off. Lucy said, any advice on cannula pain? Burning sensation where it was placed. Okay, so like where your IV was placed? Yes. So I feel that like has been that can be painful for like a couple weeks. Just bruised, annoyed. Yeah, you're saying a little burning. All that's normal, just because that IV, when it's in there, it irritated a lot of things, and now it has to heal. Something about progesterone. Sorry, not able to talk too much about early pregnancy stuff. They won't see me until 10 weeks. I found out at the ER and they told me everything looked fine. It's hard to say, those early pregnancy things. Did you get a positive pregnancy test? I don't know. That's the only thing I can think of. Again, not awesome with like super early pregnancy tips. 35 weeks and baby is LGA, which means baby is big. Getting a C-section at 31 weeks. Are there any other problems with that? Just having a C-section. So I would totally recommend, Linz, to make sure that you're getting a prenatal class so that you understand what's going to go on in the C-section. In my class, I have a whole lesson on C-sections. It's not like super long, but I'm going to go through like, it's going to be cold in the OR and you're going to hear lots of different counting, which a lot of people are like disconcerted by, but these are like regular routines in every OR across the United States. And then in my, recovery things, I also have a section on best tips for recovering from a C-section. And I think both of those would be really handy. It is the online prenatal class for couples. You can find it under resources on my site in my link in my profile. Oh, you thought you had food poisoning, you went to the ER and found out you were pregnant. Yeah, so it's tricky. You can have a positive pregnancy test before you see a heartbeat. So yeah, hopefully you can get one soon. Sure, Linz, thanks for being here. I'm 34 weeks on high blood pressure medicine. Baby is measuring a little ahead. Do you think I'll go early? Hard to say. Nobody knows. I wish I had a crystal ball. I just posted a video here on TikTok, well, on all of my platforms, that talked about, do you like cervical dilation? How much does it mean? Yeah. All right. I am going to be ending this soon. Susan said, baby was measuring small by 6 days and everything was fine, but should I be worried or is that normal? No, because it's just a growth curve. So that's just like comparing your baby to all the other babies out there. They're just a little bit smaller. But you know, like if you looked around at a kindergarten classroom, is everybody the same size? No, your baby's just a little bit smaller right now. So that's what that is. Choline supplements in the 3rd trimester. I have a nutritionist that I recommend, and she's been posting some interesting stuff about choline. I would talk with your provider. All right. You were so helpful. Thank you. Thanks for coming, you guys. So come join me in the online prenatal class for couples. It is the easy way to get prepared for birth. You can find it through resources. Remember, there's like the short class if you just want the basics, or there's a bigger class where you can come join me and talk about nutrition and what else are we talking about? Nutrition, breastfeeding, baby care, baby sleep, making the choice to have an induction. There's a few different bonus videos that you guys can find out in there. Lily, a lot of people will ask if it can still be helpful for parents. So the way it's for couples is that I have couples questions for couples to discuss after watching the video together. So you could read through those questions, see if you've already got them in your mind. It's a lot of things like who's going to come into the labor room, where's baby going to sleep. So some of them can still be really helpful for you. Or if you have somebody coming in, it's going to help you with the baby after. I think you can do it with them, but that's why it's a couples class, but can easily be done on your own as well. And come join me tomorrow morning at 11 a.m. I'm going to be here with the March of Dimes talking about aspirin during pregnancy and how it can help prevent preeclampsia and others issues. When I was talking to the lady, it can also help prevent preterm birth. So it's all just super exciting. I would love for you guys to follow me. I think you can like set a little thing that if I go live, it can alert you and then you can come join us because I think it'll be really helpful. If you want more information about it right now, the March of Dimes actually just released a video today that you can go and watch that has some helpful information, has a few doctors on there. But if you're wanting to ask questions, we're going to be doing a live here tomorrow. And I would love to see so many of your friendly faces on there as well. So thanks for joining me. I hope you guys have a great night and